My dear friends, I love to be back online. This is Dr. B. Dr. B is here to talk to you about the best natural medication to treat your high blood pressure, guys. The best and the best and the best, guys. Dr. B is here not to BS you. Dr. B opened this YouTube channel very recently, not to sell you any stuff, not to sell you any fake stuff, not to sell you any fake products and blah blah blah, sponsor you any fake remedies and stuff. If you follow me, guys, my instructions to you, my teaching to you is always simple, easy, to the point. I'm never going to give you lectures for hours about this topic, this medication, that medication. There's already millions of articles online. You can Google them and read about these different medical topic online. You don't need me. But you need me to make it easy to understand for you and to keep you away from all these charlatans and quacks who are selling you fake stuff that have absolutely no scientific evidence to back them up. They make billions of dollars, these people online, and who are trying to sell you stuff, and they don't care. They are unscrupulous people. Dr. B here doesn't need your money. Dr. B here is here because he genuinely loves medicine. He genuinely loves people. I love you, and today I'm talking to you about the best natural remedy for your hypertension, guys. And the best of the best, guys, is to lose weight, but not just a little bit, a significant amount of weight. Guys, let me tell you about my own history, right? Dr. B right now 50 years old. I'm 50 years young. High blood pressure runs in my family. My mom has it, my dad has it, my brother has it, my sister has it. Remember, guys, that high blood pressure, 30% of mankind, 30% of the 7.5 billion people on earth, right, have it. 30%. It's crazy. I'm talking about the adult population, right? Hypertension in children and teenagers is a different topic. I'm talking about the mature adult, right? Like me and you. 30% of mature adults, whether man or woman, do have hypertension. It's the most common cardiovascular condition in the world, right? High blood pressure. 30% of mature adult in the world. And it's, of course, mostly genetic, right? Everybody in my family has it. I'm 50 years old right now. When I was 5 years ago, when I was 45, I was buffed up, right? I was very muscular, right? My testosterone was very high, going to the gym all the time, lifting weight, being buffed up. I was not only muscular, but I had also this fat on top of my muscle, right? Because you gain muscles and fat at the same time, right? And then I was like 195. My top was 200 pounds. Now I was very muscular, like this, buffed up and lifting, pushing, squatting 300 pounds, and then bench pressing 250 at the leg press. It was crazy, guys. And then I started to have joint pain, right? Because it's crazy. Your joints, you are destroying your joints when you do that, right? So I decreased the amount of weight that I was lifting, and of course, a lot of my muscles disappeared because I wasn't pushing heavy like before. And obviously, as time passed, also my testosterone decreased, right? So my decrease in testosterone and the fact that I wasn't pushing heavy anymore to save my joints, right, made me reach about 180 pounds. When I was 200, 190, 195, my God, my blood pressure was high. My blood pressure, I'm like, my God, I'm starting to be like mom and dad and my brother and everything, right? And thank God, as I lost a lot of mass, muscle mass, but also fat, right? Right now I'm on the keto diet. My God, I dropped to 180 pounds. And then when I became a few years ago serious about the keto diet, guess how many pounds I am right now? I'm 160 pounds. Now think about it. From my top 195, 200 pounds, I am now 160 pounds. Means I have dropped 40 pounds. I have absolutely no fat anymore. No fat under my skin, no fat around my gut, no visceral fat. And even though I have lost a lot of muscle mass also, right? Lower testosterone, no longer pushing heavy weight so that I preserve my joint, right? I am now so good looking, right? My muscles are nice and crisp. You can see the fibers of my muscles under my skin because I look like Bruce Lee right now, right? All I need is a tan and some oil on my body. I look like Bruce Lee. No fat, very nice and lean, but all muscles, right? I look like that, guys. It's so beautiful. So even though I'm only 160 pounds, it's all muscle, guys. There's no fat, right? I have lost all my fat thanks to the keto diet, right? And guess what? My blood pressure is now that of a baby, right? My cholesterol, that of a baby. My fasting sugar, that of a baby. My hemoglobin A1C, that of a baby. My liver function test, my kidney function test, everything, that of a baby, right? I sleep also 9 hours a day. So I combine, right, this huge weight loss with good sleep, keto diet, no more fat, right? Obviously, I don't drink alcohol. I don't eat processed food. I zip my mouth, right? I don't eat like before, right? It's a combination of everything that you have to do to reach this significant amount of weight loss so that you just don't need any more high blood pressure medications, right? So let's suppose you are 200 pounds and you lose 15% of your body mass, right? 15%, you're 200 pounds, and you lose 15%. You're going to be down, you're going to lose 30 pounds, right? You're going to be down to 170 pounds. My God, your blood pressure is going to disappear, guys, right? Or at least instead of needing 3 medication or 2 medication for your blood pressure, for your high blood pressure, you're going to need only 1. Your doctor going to say, now I'm going to give you only 1 medication and at a lower dose, right? It's amazing what it can do. Again, I'm saying significant weight loss. It's not enough like my sister to lose just 5 pounds. It's not going to do nothing, right? 5 pounds not going to do nothing. It has to be significant weight loss, right? Let's suppose that you're 180 pounds right now and you have high blood pressure and you're taking 2 medication and you have also diabetes, right? 180 pounds, right? Lose not 15, but just 10%. It's 10%. It's not a lot to lose, guys. Come on. Means you're going to lose 18 pounds, right, of your body weight. And losing 18 pounds from 180 pounds means you're going to go down to 162 pounds. So you're going to be like Dr. B, I'm 160 pounds. Guess what? I'm 6 feet tall, right? 160 pounds. My God, I feel so good. So you're going to be like me, right? Like me. And my body mass index, my BMI is at 20. I'm 6 feet tall, 160 pounds. My BMI, body mass index, is at 20. Imagine that. Remember, the BMI is normal between 20 and 24.9. Once you reach 25, you become overweight. Once you reach 30, you become obese. Obese. That's half of the US population, right? And then once you reach 35, you become morbidly obese. Morbidly obese, all right? That's crazy. Dr. B's BMI is at 20. 6 feet tall and 160 pounds. Flat tummy, no fat anywhere, no visceral fat, right? I exercise every day. I sleep good. I follow my keto diet. I eat only 1 time per day for breakfast only. During lunch and dinner, I have only a few little snacks of nuts right? A little bit of peanut butter, a little bit of tomato paste, a little bit of fat-free, sugar-free yogurt. I stay away from carbohydrates, guys. I stay away from processed food, guys. My God, I feel so good. I feel like I'm 20 years old, right? I look better and feel better than my nieces and nephews who are 30, 40 years younger than me, right? It's crazy. I mean, remember, half of the U.S. population is overweight. 1/3 is fat, overweight. Half of the U.S. population is overweight. Half of the kids nowadays are overweight, right? Half of children in the U.S. are overweight. 1/3 of them are fat, right? 10% of adult population suffer from anxiety, chronic anxiety, chronic depression. 15% the same thing. 15% of the children suffer from anxiety disorders, depressions, all these chronic mental disorders. It's crazy what our population, whether children or adult, are going through or doing to themselves. It's not their fault. It's the food industry, right? That pushing all this garbage into our throat. They make billions of dollars, right? All this entertainment industry and internet and blah, blah, blah. Computers, lack of physical activity. Mom and dad don't have the time to cook anymore because they're too busy working 2 or 3 jobs to pay the bills, so they give the kids McDonald's and pizza and blah, 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 right? It's crazy. Now, let's suppose you're 160 pounds, right? 160 pound female, petite guy, petite man, tall, petite person, right? A petite body. And you're 160 pounds and you have high blood pressure, diabetes, blah, blah, blah. Let's suppose you lose only 10% of your body mass. That's only 10%, right? It's not a lot. It means out of 160 pounds, you lose 10%, you're going to lose 16 pounds. It's doable. Believe me, it's doable. And you're going to go down to a body weight on 144 pounds. My God, you're going to feel so good, right? Remember, everything depends on how tall you are, right? On how tall you are. If you are like me, 6 feet tall, I look so good and so great. I feel so great. I look so good when I look at myself in the mirror, right? I'm 160 pounds, 6 feet. I look perfect. I look like Bruce Lee, right? So same thing. If you are not tall and you are like 160 pounds, then you lose 10%. You're going to go back to 144 pounds. You're going to look so good. The worst situation is when you are not tall, right? And you are extremely obese. That is the disaster. Or when you are tall, like 5'11", right? Or 5'10", or 6'1", 6'2", and you are like the guy is 250 pounds. Guys, I see a lot of these people, a lot of patients like this. The guy comes to the clinic, he has heart failure, kidney failure, diabetes. He's tall, he's like 6 feet like me, 6'1", 5'11". Tall people. The guy was 250 pounds, 260 pounds, 200... big tummy, right? Oh my God, it is crazy what people do to themselves, right? For this pleasure of food, right? And they want to enjoy life. Guys, this is not enjoying life. This is self-destruction, right? Eating like that and becoming bigger and bigger and bigger and bigger over the years, reaching 200 pounds. The guy is only 5'10" and he's 200 pounds. I mean, it's crazy. The guy is 6 feet tall. He's 250 pounds. The guy is 5'6", right? And he's 190 pounds. Guys, this is not enjoying life. This is self-suicide. This is self-destruction. This is suicide, right? You are destroying yourself. You are killing yourself slowly but surely. You're just going to have a heart attack, stroke, and kidney failure, blah, blah, blah. The diabetes that you have going to destroy your eyes, going to destroy your brain. You're going to have dementia. It's going to destroy your kidney. You're going to have to wait for a kidney transplant. transplant. You're going to destroy your heart. You're going to have cardiomyopathy. It's a disaster that what people do, right? The combination of diabetes, high blood pressure, blah, blah, blah. The side effect of all these medications. Dementia will come at the age of 60. By the time you want to retire, enjoy the money with your wife, and you're going to be diagnosed with heart failure, blah, blah. You're going to be bedridden. You're going to have dementia. You're going to develop cancer, right? People who are overweight and obese are higher risk of having cancer, right? It's crazy. Don't do that to yourself, right? Guys, Dr. B loves you. Dr. B is here to not BS you. Dr. B will never sell you fake stuff, fake products, fake remedies. I'm not here for that, guys, right? Dr. B makes enough money at the clinic, and Dr. B will never ever retire, so I don't need to stress out about more money for my retirement. I'm going to keep doing medicine until I'm 100 years old, God willing, right? I'm here to help you age gracefully. I'm here to help you stay away from all these medications, because all these side effects and blah, 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 blah. Patients come at the clinic with a list of 10 medications, one for this, one for that, another one, 2 medications for diabetes, another one for high blood pressure, another one. Oh, now they come up with this Ozempic stuff with all these side effects. I mean, it's crazy. The pharmaceutical industry pushing this medication down the throat of patients, right? Pushing the doctors to prescribe more and more. And on the other side, you have the food industry that pushing all this garbage down the throat of patients, of people, right? You need to do like me and make food, put food in the little corner of your life, right? For Dr. B, food is a little corner of my life, right? I still remember, guys, when food was the center of my life, sex was the center of my life, right? Thank God I got rid of those crazy days, right? Now sex is no longer the center of my life. Food is no longer the center of my life. Food and sex are in that little corner of my life, right? I love food, I love sex, but not like crazy like when I used to be in my 20s or 30s or 40s, right? Now I'm 50, right? Food, thank God, is absolutely in that little corner, right, of my life, right? I'm not like my sister or family member. We need to enjoy life. Oh, what do you mean you need to enjoy life? So enjoying life is stuffing your face 5 times a day with this nasty processed food and get bigger and bigger every year and develop diabetes, high blood pressure. Then you have to go have all this medication with all the... I mean, it's crazy what people do for enjoyment of life. Come on, guys. Overeating, overindulging us food. Who said it's part of enjoying life? No, it's not. After a certain age, you need to cut it off. You need to zip your mouth, right? To be healthy like Dr. B, right? No body fat, no visceral fat. My tummy is flat like a board. I sleep good at night. I go exercise regularly. I keep my brain active and challenged. I have a job that is rewarding, blah, blah. I have a low stress life when I come home, right? You know what I'm saying? You need to do all this, guys. Otherwise, remember, it's a combination of everything, right? It's not just to lose weight. Otherwise, it's just not going to work, guys, right? So I love you guys. I feel like the good old days when I used to teach medical sciences to student nurses and student medical students and X-ray student, MRI student, and a medical assistant. It's like the good old days when I used to teach, right? I stopped teaching because too much work at the clinic, right? But now I'm back teaching online to you guys, to you, my audience. You guys are my students, guys. I love you so much. You guys give me so much happiness, and I give you love back the same way my patients give me so much love. I give them love back. I give you love back, a big hug back. Get back to me if you have any comment, any questions. I promise I will get back to you. Put them down there. It will take time. I'm so busy with work and blah, 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 blah. But I promise I will get back to you. I love you. Thank you for your viewership. And I hope I can make you grow older just like me, healthily, so that you can get like Dr. B to the age of 100 with no nasty diseases and cancers and chronic diseases, no dementia, nothing, guys. I love you. Bye bye. Hope to talk to you in the next video. Thank you.